it's a wonderful day. It's a great day, and let's talk about EFT. EFT, it stands for Emotional Freedom Technique. And when we talk about EFT, the origin goes back to many thousands of years ago. It roots into acupuncture. Okay, acupuncture, and as we know, the origin of acupuncture was from Tibet in the 4000 BC, and then through China, that was in 200 BC, and of course it has evolved a lot through the Japanese acupressure, and then also the Western style of acupressure. So from that, it evolved into TFT, or what we call the thought field therapy, that was introduced in 1979 by Dr. Roger Callahan. And also there's a lot of other research that was done by other medical doctors and also psychiatrists like Dr. John Diamond in the year 1970s as well. So the emotional freedom technique is a technique that was introduced by Gary Gregg, which is an evolution of the TFT, or the thought field therapy. So the EFT stands for emotional freedom technique. Okay, so in emotional freedom technique, what we believe is that the cause of all negative emotions and uncomfortable feelings is the disruption in the body's energy system. It causes that. So when there's a disruption in the body energy system, it creates a lot of negative situations in the body as well. So there are three things. One is the psychological impact that causes disruptions in the body, and the other one is physiological, which is physical, and then the third dimension is the EFT, which is related to the energy. So that is psychological, there's physiological, and there is another one called energy, the third dimension. And so the EFT addresses from the standpoint of emotional freedom technique or the energy work. So so whenever there is an emotional condition that is impacting a person, the body cells in the body cells get affected, and when these body cells get affected, it directly impacts the certain energy flows in the body as well. So one of the EFT work is to correct the flow so that the body cells can function correctly, and these have been proven by many work, the thousands of work that was done by many practitioners, thousands of practitioners. In fact, the most amount of practitioners of EFT reside in the US, UK, and Australia. So this is where the major research on EFT is going on. So what we're going to talk about is, when we talk about EFT, as I mentioned earlier, it is some form of acupuncture, but we don't use any needles. It is using tapping. So we will tap the meridian points, and I will show you where are the meridian points. And by tapping these meridian points, we are actually unblocking the flow of energy, and these have created a lot of miracles in many people. In fact, I've personally been practicing this, and I've seen many of my friends, individuals, where the pains have been taken off, especially the unnecessary pains, right? Because we don't have to suffer for the unnecessary pains. And again, EFT is not a substitute for the medication you are taking. So this is one caution I want to give. Whatever the medications the doctor have subscribed, please don't stop those medications. EFT is a supplementary treatment. So please continue with your doctor's advice, and also keep taking the medication. When the problems go off, you should take it back to the doctor and say, I don't have this problem anymore. Do I have to take this medication? So let your medical doctor decide whether or not to stop the medication. You should not stop your medication on your own without getting the medical doctor's advice. Okay, so now let's talk about the meridian points. Okay, there are several areas where the meridian points are. Okay, so one is right here. Right here is also called your chakra, right? In fact, this is also one of your chakra point. is also one of the point. And then here, there's another point here. Okay, there's another point here. Another point here below your nose, above your lips, and here below your lips. Okay, and here is your collarbone, just right below your collarbone, right? Collarbone. And then here, your armpit, right under your armpit. Okay, right under about 3 inches below your armpit, right there. And then the other point is, you see where your nipple is? Right below your nipple, okay? Right below your nipple, you see the rib bone, the rib cage. Right below the cage is where you tap. This is for guys, for boys and girls, right? It's the same point, okay? And then also on the hand, there's a few points that we must remember. Okay, we will be tapping here, right here, right? And then here, this finger. We will skip this finger and we will go straight to the last finger. Okay, so remember here, the thumb, here, the edge, just by the side. Use 2 fingers to tap, right? They're just like tapping here. We'll miss that and we'll go to the last finger. And then here, this place is where your karate chop is. Okay, and that's the last point, which is called the gumut point. It is right here. Here, right here. So that's your gumut point. Okay. So let's go through it again one more time. Here, 1, 2, 3, 4, 5, 6, 7, below your collarbone, under your armpit, right? Or you can tap it here, right? Under your armpit, here. And then right below your nipple, right here. Okay? Alright, so there's two things in this tapping. One is we are going, what we call is the setup. The setup, this is the initial setup thing, setup tapping. And that we will be only tapping on the karate chop. This is where you chop, karate chop, right? So just follow what I do. So I'll be, just follow this video and it'll be fine, right? Okay, so before we get started, there's another thing called the pain rating system, right? I mean, where you rate the pain. What is the rating of your pain right now? When we talk about the pain, there's a rating from 1 to 10, right? So 1 is there's no pain. There's 0 pain. So that's 1. That's the best situation everybody want. And rating 10 is it's super painful. I mean, it's super pain. I mean, it's terrible situation. I mean, emotionally, whatever. I mean, it is the worst thing that you can ever get to, right? 1 is the best situation, 10 is the worst. So I would like you to first, before we get started with this session, I would like you to rate it right now. Just think of the pain, where the pain is, or the problem that you're having, whether it can be the pain or the problem, any situation that is really that you're looking forward to recover from, right? In this case, you're having the shoulder pain, right? So think of that shoulder pain and then rate that pain right now. How much of pain is it giving you? How much uncomfortable situation you're going through? Okay, so please rate the pain right now. Okay, so let's continue. So you have rated your pain. Okay, good. Okay, so this is what we call the subjective units of distress, or SUD scale. Okay, this is what we the name that we use, SUD scale in the EFT. Okay, which ranges from the rating is from 1 to 10. Okay, so we have already rated your pain now. Obviously, it is not 1, 2, or 3. It must be above 5, I hope, right? Okay, so after the round of EFT, we are going to rate the pain again. Okay, so follow what I say, okay, and what I do. What I say and what I do. So do exactly what I do and say what I say. Okay? All right, so we are going to do the initial setup. Okay? All right, so we are going to tap on the karate chop here. Okay? So before we do that, let's relax our body. So just breathe in slowly and breathe out slowly. Okay? So let's do that 3 times. Let's do it slowly. Okay. So let's start to tap here and say what I say. Even though I have the pain in my right shoulder, or you can mention whichever area you have the pain, or any other situation. So in this case, I'm going to use the word right shoulder pain. The pain in my right shoulder, even though I have the pain in my right shoulder, I deeply and completely love and accept myself. Even though I have this pain on my right shoulder, I deeply and completely love and accept myself. Even though I have this pain in my right shoulder, I deeply and completely love and accept myself. Okay. This pain on my right shoulder, I don't like this pain. I don't want this pain. My right shoulder pain, it is frustrating. It's bothering me a lot. My right shoulder pain. I don't know why, but I'm having this terrible pain. My right shoulder pain. I don't want this pain. It is bothering me a lot. It's disturbing me. The right shoulder pain. And here, under the armpit. Yeah. The right shoulder pain. I don't want this pain. I don't like this pain. It's bothering me too much. It's very frustrating to have this pain. Don't like this pain. This is my right shoulder pain. I don't know why I'm suffering from this pain. I don't like it. I don't want it. My right shoulder pain. It's so painful. I don't want it. Breathe in and breathe out 3 times. So I want you to rate the pain one more time on the scale of 1 to 10. Okay, if it has reduced a few points, that's good. Or if a new pain I have developed in some other areas, then we are going to tap on that new pain, because there are cases when, because we are working with energy disruption, there could be some sudden pain that all of a sudden that have emerged, which was not there before. So now we can tap on that pain, that new pain that has emerged, or we can continue to tap on that right shoulder pain. Okay, So let's continue another one more round on the right shoulder pain again. Okay, my right shoulder pain. I don't like it. It is very frustrating. It is still there. I want it to go away. It's bothering me. It's affecting me. I don't want this pain. This pain is useless. It's of no use for me. It frustrates me. It's affecting me. I don't know why I'm having this pain. But I don't want this pain. This pain on my right shoulder, I don't like it. I don't want it. It's pain. It's horrible. I want to be free from this pain. I want this pain to go away. I don't want to have this pain. I don't like this pain. I want this pain to go away. I don't like this pain. This pain. I don't want this pain. I don't want this pain. It is frustrating. Breathe in and out 3 times. Open your eyes. Think of that pain. Have it reduced? How much have it reduced? Go back to the scale of 1 to 10. What is the scale now? Okay, that's reduced a lot. Good. If not, we'll do another round of tapping. Okay, so do this until you're comfortable with the pain and you're in acceptance of the pain where it is a lot lesser and it is not bothering you, or maybe even disappear. Okay, and in the process, if you have other issues, you do the same thing. Instead of shoulder pain, you'll replace it with some other thing. And again, as I mentioned earlier, in this process, if a new pain have emerged, you will do the same thing. You will tap the same way on that new pain, mentioning that new pain. Okay, and remember, your setup is this. Okay, you tap here and you will say, even though I have this pain, even though I have this pain in my right shoulder, I deeply and completely love and accept myself. That is only the setup. After that is these rounds. Okay, the tapping here you only do 1 time for the whole session. Okay, after that it is all here, 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 under your armpit, under your nipples, your thumb, first finger, second finger, skip the 3rd one, go to the 4th one, here, and here. Okay? Okay, so all the best, and I hope you'll be recovering soon. Thank you. Bye-bye.